sorry, y'all. I'm on this hair program. Let's take a look at the ponytail real quick. The ponytail is ponytailing. Hey you guys, happy Wellness Wednesday from Ashley here at Aspen Wellness. Ash the MP, Nurse Mama Ash, Ashleymalaysia. We're here with the Wellness Wednesday and I'm so excited to give you guys Wellness Wednesdays. I'm really passionate about wellness overall, and in my clinical practice, I primarily work in reproductive health, lots of women's health, and I come across a lot of topics to where I feel like, okay, like that seems common, but it's not common. So I'm learning that a lot of things, there's a knowledge gap. Obviously, I know about it because I'm a nurse practitioner. I went to school for it. I work in it, but a lot of women and men do not know some things. So let's get into it. So on this Wellness Wednesday, I want to talk about, in honor of summer, it being hot, let's talk about yeast infections. I just want to talk about yeast infections, Candida albicans, Candida. So what is a yeast infection first off? And let me just rewind and say that I just want my Wellness Wednesdays to just be straight to the point. I want it to be so simple that a 5-year-old could understand this information and tell a friend to tell a friend, because this information may be relevant to girls in middle school as well and younger adults also. So I just really want to make the information just layman's term, plain and simple, not going to use any fancy medical jargon when explaining this information. I just want it to be easy to understand. So it's summertime and we call this yeast infection season just because yeast grows in warm, moist, dark areas, and our vaginas are the perfect host for yeast to grow. So I'm just gonna give you the most common cause of yeast infections. We'll talk about the symptoms of yeast infections, different treatment methods, and what you should do if you got a yeast infection and if it's your first yeast infection and you kind of don't know what to do. So first and foremost, the most common symptom is itching. So patients can present with itching. Very common for the discharge to be thick and clumpy, looking like cottage cheesy, just super thick and clumpy, very tender, painful, redness. Those are all normal, but they don't all have to be present. So sometimes it can just start with a slight itch, sometimes it can be swelling, and then each time you get a yeast infection, the symptoms don't always have to be the same. So just because one yeast infection, you might have had a lot of cheesy discharge. If you have another one, you might just have a lot of swelling and irritation, and you might not see that discharge yet, okay? So those are just the most common symptoms that women experience with yeast infections, okay? Now let's get into causes. So like I said, yeast grows in warm, moist, dark areas. So if you're a woman, you gym it a lot, and you get yeast infections often, what I want you to do is, as soon as you work it out, sweat it out, I want you to change out of those wet underwear, change out of those wet bottoms as soon as possible, because you're creating the perfect host for yeast to grow. Also, swimming. We wear our bikinis, our bathing suits in the water. As soon as you are out that water, take the bathing suit off, dry the area off, and most importantly, let the vagina breathe. Tight fitting clothes, tight pants, thongs, super tight underwear, all can contribute to having yeast infections more common. Also, underlying health conditions such as diabetes can also contribute to having yeast infections as well. So that is definitely something to think about. And now we're gonna get into treatment methods. So my favorite treatment for yeast infections is fluconazole. So fluconazole is just a little bitty pink pill. You take it one time. You do need a prescription for this, and I suggest if you are a young lady or even an older woman, whatever the case is, if it is your first yeast infection or if you've never experienced anything like this, definitely come and get evaluated by your provider just to ensure that it is a yeast infection, because I know oftentimes women can assume just because they're having some itching that it's probably a yeast infection, but it could be other things that are causing the itching and irritation. So I think it's really important to always go to your primary care provider if it's your first yeast infection. There's also things such as monostat creams, which you can purchase over the counter. I personally do not care for those products. I feel like sometimes they're too strong, they can burn, cause more irritation. But in the case that you do, if you do decide to just do an over-the-counter treatment, give it some time to work Even if you do a 1 day, that does not mean that the yeast infection is going to be cleared in 1 day. It may take several days to clear up, so please be patient. If you do a monostat 1 day, it's not going to clear up in 24 hours. I'm so sorry. It's probably not going to clear up. But I hope I answered all the questions you guys may have about yeast infections. So some myths or some things that I hear often is when a woman comes in panicking, like, oh, my boyfriend, my husband's cheating on me because I've never had a yeast infection. No. Like I said, yeast grows in warm, moist, dark areas. Also, another thing, antibiotics can commonly cause yeast infections just because they kill our good vaginal flora and our bad vaginal flora at the same time when fighting other types of infections and whatnot. So what I suggest is, if you know you're going to be put on a long-term antibiotics, talk to your doctor or your primary care provider about having fluconazole prophylactically, meaning just having it on hand in case that yeast infection does happen. You'll already have it. And that is our Wellness Wednesday topic of the day. If you have any questions, please drop them below. If you want me to clarify anything, make sure to drop them below. But like I said, this is just from my knowledge, the populations that I work with. So like I said, if you have any questions, comments down below. Click follow, share, tell a friend to tell a friend to tell a friend to tap into Wellness Wednesdays here at Aspen Wellness with me, Ash the MP. You guys have a good one too.